And here we go. Okay, good evening, ladies. Today I have Dr. Jason Gonzales here with us to talk about balance. And it's a topic that we've tossed around a little bit in class, and it's really a meaningful topic. And one of the things I want to start out with in introducing Dr. Jason is just having him talk a little bit about his background and who he is, because
Sure.
we've worked together several times on different topics, and I really don't know much about your personal background. So I thought that'd be a good place to start.
Yeah, absolutely. Well, thanks again for having me on Mary Jo. I'm excited to participate and help out where I can. So my journey to chiropractic started from sports. I used to race bikes at a pretty high level earlier in life, late teens and early 20s, and I was traveling around the country and competing in national level races. And actually, in 1998, I raced against Lance Armstrong before he went over to Europe and began his
Wow.
tours there. And yes, he won, but now we all know why he won, because he's a cheater. Um, but anywho, yeah, so my on-ramp into chiropractic was through sports. When you crash your bike and you get beat up and everything, you quickly find yourself in the office of acupuncture and massage therapy and chiropractic. And, when you get up to a certain level in athletics, you get drug tested. So you can't have any, you can't use certain medications. You can't use certain, pain relieving ointments or everyday folks can use. So we had to look for more natural ways to not just handle aches and pains and issues, but also natural ways to try to boost performance. I wasn't just trying to get rid of a headache or something. I was trying to, push my body and test my limits. And, chiropractic was a part of that equation, along with nutrition and everything else. So that was my first exposure to it. And, I didn't know then what I know now. And so I was under the impression that pretty much every chiropractor practiced the same way that the chiropractor I was seeing, they all call themselves chiropractors, and so they must all do the same thing, right? Well, that's completely not the case, which is kind of a challenge for people trying to find a good chiropractor. You can't always just know what kind of style you're going to get based on the name. But anyways, long story short, I was intrigued enough by my experience as a patient that I knew I wanted to do something along those lines in healthcare. And my original thought was physical therapy, but I did that for an intern for a physical therapist for a year, and it wasn't what I was looking for. And I kept going back to my experience as a patient of my chiropractor, and the guy always seemed to have a good time and helping people, and it was hands-on, and it was active, and it was physical, and I loved that part about it. Wasn't real technical and real objective, my experience there, but I've since found some ways to help that. Anyway, so I went to school thinking that was what I was going to do. I was going to work with athletes and work with families and such. And it wasn't until I got to chiropractic college, backing up a little bit. So I did my 4-year degree at University of Washington in Seattle. So I'm from the Seattle area. That's where I was born and raised, and that's where I did most of my racing. So when I decided to shut down the racing and focus on school, I went to the University of Washington for 4 years. I got a degree in psychology, just a BA in psychology. And while I was there, I got my prereqs done for the chiropractic school. And the prereqs for chiropractic school are very similar to the prereqs for med school. Not nearly as competitive, but similar, science background and physics and organic chemistry and such. And I got to chiropractic college, and it wasn't until I got to school in California, where I came down to the Bay Area to go to chiropractic college. It wasn't until I got there that I realized there's a lot of different little niches or specialties within the profession. And you don't always have to work with athletes. You can work with kids, or you can work with, pregnant moms, or you can work with, geriatric population or sports medicine. And that's when I found, or rather, as I was first exposed to the kind of chiropractic care that I provide now, which is called upper cervical meaning upper neck. That's the only place I actually physically work on a patient, is their upper neck. And the kind of cases I help manage and the kind of conditions that I'm able to help people with are all over the body, literally head to toe. But it's because of the unique relationship with the upper neck and the autonomic nervous system that you can help a lot of different chronic and recurring conditions that don't seem to respond very well to other, maybe more common or traditional methods. You can help a lot of those by improving the autonomic nervous system function, which is oftentimes impacted negatively by issues in the upper neck area. So that's the work I do now. So rather than seeing sports related injuries and bumps and bruises and that kind of thing,
Mhm.
acute, injuries. Now I'm seeing people that have chronic and recurring problems, vertigo and migraines and thyroid issues and autoimmune issues and digestion problems and balance problems. And,
Right.
many of my patients have tried the more common approaches, and been met with limited or lack of results. And many of them, it's because they have an issue that's kind of flying beneath the radar in the upper neck in terms of the alignment and the structure of the upper neck and how it moves. And that dramatically will affect brainstem function or autonomic nervous system function. And that seems to be the reason they have this glass ceiling they can't seem to get past with their symptoms. And once I'm able to address the upper neck problem and I kind of let their body function more normally, that's when they really begin to see the results. And so that's the kind of chiropractic care I provide now.
Yeah, so that whole specialty, which is something I didn't know. I mean, that's so funny, not funny, but it's so interesting that we've talked many times. And today, I didn't realize, being a bike racer is pretty intense.
Yeah.
And I didn't realize that you were from out of state. Those things and stuff. So thanks for sharing those. And then also this just kind of leads me in to balance is probably a really big part of what you're doing with people. So maybe you can just kind of segue into that and just talk about what are the basic components of balance.
Yeah, great question. Thanks for the
why are they so needed? Why do we, I mean, I know we need them to stay, because if we don't, we're
right. Right. So balance, and this is something I think is helpful for everyone to understand, just a basic understanding, because I think it makes you more prone or more apt to do some of the things that we recommend you doing, because now you understand exactly how it's, affecting your system. Otherwise, it just might sound like a weird request if you don't know it. But balance is a product of sensory integration. So your eyes are constantly feeding information to your centers in your brain. Your inner ears are always feeding information into your, balance centers in your brain. And so too are all the joints in your body. Not just the joints, not just where two bones come together and move, but the ligaments and the tendons, all of those soft tissue elements, muscles as well, they all have receptors in them that are constantly sending information up to the brainstem and other balance centers in the brain to let the body know physically where it is in space, right? So in order for somebody to have good balance and feel stable and feel confident and not feel like they're going to risk falling over, what has to happen on a nervous system level is their nervous system, the brainstem, way the back of the head, that has to successfully take in information from the eyes, from the ears, and all the information coming up from the body, and those have to all match. And if those things match, then the person feels like they've got good balance. But if any one of those inputs, eyes, ears, or the body, don't match the other, then they begin to feel off balance, right? So commonly in my world, people that have recurring balance problems, they've all had their eyes checked out and everything seems to be normal there. Many of my patients, before they come to work with me, have been to the ENT and they've had their ears looked at and things seem to be fine there. So the one thing that hasn't been checked thoroughly is that feedback from the body, and that feedback on a doctor scenario or doctor language is called mechanoreception and proprioception. And different parts of the body, if you want to think of it this way, different parts of the body shout louder messages to your brainstem. So for instance, if you have a problem in the spine, in terms of how your spine moves, or maybe a joint or two in your spine is stuck and not moving normally, that's going to have a bigger impact on your balance than having like maybe a toe problem or a finger that gets stuck or an elbow that gets stuck. Your body weights differently different parts of your body for balance. And in terms of where does most of the nervous system information come from that helps you keep your balance, most of it comes from the spine. And then even within the spine, most of that information is coming from the joints in the neck. So making sure that your neck and your spine are able to move normally through their entire ranges of motion and they're not stuck or kinked, that will make sure that the neurological feedback that's being fed into your brainstem matches the same feedback that your eyes are seeing and that your ears can feel, right?
Mhm.
And so arthritic spines, spines that are stiff and stuck and not able to move normally, if you want to think of it this way, that's turning down the amount of information your body's giving your brainstem. And so now the neurological information that your body, that the brainstem senses from your body doesn't match the same information that your eyes and ears sense.
Mhm.
And now there's a mismatch. And now you feel off balance.
Mhm.
So working on the body, working on all the joints of the body, even if they don't feel achy or sore, but making sure that you mobilize all your joints and move them through their full ranges of motion.
Right.
That's feeding your brainstem balance centers, just like you water your plants with water every now and again and give them some fertilizer. Moving your body is like water and fertilizer for your brainstem's balance centers.
Mhm. So it sounds like it sounds like these ladies that come to class, they're doing exactly what they need to be doing, because they're moving, and the more we move, the more we're in alignment.
Right.
And so that's good. Can you maybe talk specifically about some of the things that we can do, just kind of really simply, to help our balance?
Absolutely.
Yeah.
Yeah. So, starting from the top down, I would recommend, people that already have balance challenges or people that are at risk of falling, I'd recommend you do these things while you're sitting down.
Okay.
Or, you can do these things standing up and be holding onto a back of a chair or a wall or
Mhm.
something, just, so you don't
Right.
risk injury, and making sure that you have plenty of space around you should you,
Uh-huh.
stumble. But the most basic things to do first would be to learn to sync up your eyes and your ears and your neck in terms of those sensory integrations. So the way that you do that, the first thing you want to do is you want to fixate your eyes on a point. So if you're sitting in a chair, stare at something across the room,
Mhm.
and leave your eyes focused on that thing while you turn your neck one way and then the other way,
Okay.
right? So you're forcing your eyes to stay focused
Uh-huh.
while your body moves
Yeah.
around.
So I'm going to try that right now.
So stare at me. Yeah, stare, Mary Jo, stare at me.
Okay.
Don't lock eyes with me.
Okay.
Now move your head back and forth. There you go. There you go.
Oh, that's really different. Yeah.
Okay.
Yeah, I can. Yeah, but that makes sense, because I know when we're doing balance challenges, I'll say fix on something. I always think redwood tree. I don't know why. That helps me just stay really because
A
if I
good
start
solid.
seeing stuff moving around, or if I have like something behind me, I'm just, and that totally makes sense.
Yeah. So in my experience in clinical practice, a lot of my patients that have balance issues, they tell me, when they feel vulnerable or when they feel like they might fall over or something, it's usually when their eyes are moving around. You're navigating a curb in the parking lot, navigating some stairs, those kinds of things. So, in life, we're not always nice and symmetrical, and everything's not, in life we have to move and twist and put ourselves in awkward positions sometimes. So when you train your balance, training your balance is like training a muscle. You go to the gym and you work on your arm muscles, and eventually they'll get stronger.
Right.
Training those neural pathways for your balance they're the same. Nervous systems, they say nervous systems are plastic, which means nervous systems are constantly evolving and learning and adapting to what you're doing. And they're, certain nervous system neural pathways will get reinforced and fire more often and get stronger if they're used a lot, and some neural pathways will atrophy and not work very well if they hardly ever get used, right?
Right. Yeah.
So in terms of balance, you're not going to live your life always looking straight ahead and turning like this. So you have to practice those scenarios.
Right.
And
so so kind of being like, when we do the movement and we're kind of off balancing ourselves, we're working on it at the same time.
Exactly.
We just don't want to get too crazy.
Yeah. So again, going back to my little training thing. So while you're sitting down, the first step is stare at something and move your head back and forth, and not just side to side. You can move your head back, and you can move your head down. You can tilt your head sideways. So.
Okay. Yeah.
Exactly.
Yeah.
So the ranges of motion in the neck that commonly get neglected. Most of us look down most of the time. So we're texting, we're reading, we don't have any issues looking forward. Where a lot of us have trouble though, Mary Jo, is looking up and back, right?
Right.
So that
That's the,
extension.
yeah, that
And
is
when
the,
you,
yeah, I fell about a year ago, and that's what happened is I stepped out and I looked up at the moon and bam,
right?
that was
Okay,
it.
so what your body, Mary Jo, what your body's telling you is that those neural pathways that get fired when your neck's in extension, they
Mm,
probably could use some more attention, right?
okay, yeah.
So
So,
while yeah.
yeah.
So in my office, I just have people just practice the ranges of motion that you don't normally do. So
Mm,
most of us during the day look down, and
right.
the other thing we do a lot is we look over our shoulders a little bit because we drive cars.
Right.
But
Yeah.
not many of us during the course of a normal day look up very much.
Yeah.
And very rarely during the course of a normal day do we let our heads tilt side to side.
Right.
So that side to side tilt and that extension piece,
Mm-hmm.
those neural pathways just get ignored and neglected. And then when we need them in life, because we have to quickly turn our head and see what happened over there, that's when we hit the ground because we lose our orientation in those
Right.
moments, right?
Yeah.
So just working on your eye motion and your upper head and neck motion and getting those practiced in all the different scenarios, that alone would massively help somebody feel like they have better balance because they're
Yeah.
training, they're getting those sensory integration things, they're forcing them
Mhm.
to happen versus just hoping they happen, right?
Yeah.
In
Great.
a safe environment. So
Yeah.
go ahead.
No, I was just gonna say, yeah, I know that moving our head side to side really messes up our balance, and sometimes I'll do that while we're sitting or doing some things. But I think the keeping your eyes and then moving, that's something that's really tricky, and I think that's really good though. I mean, that's something
Yeah.
I didn't
If
realize. So I really,
Yeah, and then
yeah.
you can make that even more complicated. So the most basic scenario is look straight ahead as I'm
Mhm.
looking at you, and I
Yeah.
just practice moving my head and
Mhm.
don't break eyesight. I'm just doing all these things, looking at
Yeah.
you. And as I feel more comfortable doing that, and I don't feel like I'm all dizzy, then the next step is then you keep your head still and you just move your eyes side to side and up
Okay.
and down
Yeah.
and diagonal,
Yeah.
right? And then the next step after that is you'll, instead of gazing straight ahead, gaze up and then tilt your head and tilt your head and turn your head.
Okay. Yeah.
So you can play with different scenarios and different combinations of moving the head and keeping the eyes
Right.
still, or keeping
Yeah.
the head still and moving the eyes around.
And that's something that you can do. That's great. You can do that seated. You can do that in the car. You've got
Exactly.
5 minutes to wait. You can, as long as you're in a stable place. Those are some really simple things.
Yeah, even
Wow.
at a red light, you can practice those things.
Uh-huh.
But that's a really powerful way to help that sensory integration between the eyes, the ears, and the
Mhm.
joints in the upper part of your spine, your neck area.
Okay.
And then the same thing can apply for farther down. So the next step would be, you're doing this sitting down. The next step would be do this while you're standing up.
Okay.
So
Yeah.
the way I've described it to people is, if you stand, maybe you can see me if I stand in the corner of my office here. I don't know if
Uh-huh.
you can see that.
Okay.
Yeah. So if I stand in the corner of my office, so there's a corner here. There you go.
Yep. Got it.
And you can put a little sticky pad or a thumbtack on this wall and on this wall.
Uh-huh.
And then imagine I'm looking in the corner of my wall, right? And I'm on
Right.
my feet.
Got it.
So now I've got two thumbtacks here and I'm on my feet and I bring my feet closer together so it's harder to stand up.
Right.
I do the exact same thing, maybe with my hands touching the wall so I don't fall over, but I
Mhm.
stare at the corner of the wall and I
Mhm.
move my head back and forth, or I leave my head in the middle and I look at those tacks I put in the wall side to side, up and down.
Okay.
And then you can start with your feet out wide and then bring them slowly closer in as you feel more confident.
Right.
You can practice the same thing with your on one foot or the other, again holding the wall so you don't fall over.
Right. Yeah. The wall's key.
But
Yeah.
while you're trying to work on your balance, do it with the head and the eyes in different positions. And that's going to be, I think, even more helpful than trying to, some people try to fix balance by strengthening muscles. Let's strengthen your leg muscles and strengthen your back muscles. And sometimes lack of strength is a part of the equation, but usually it's not as much of the equation as that sensory integration, that sensory
Right. Yeah.
feedback.
Yeah, because you got a lot going on there. So, well, that
And then
is amazing. That's a lot of information and a lot of things to think about, and really different than kind of some of the training that I've done. So, and some of the background. So this is really good to really
yeah,
get the kind of the big picture of how balance works and how all our different, integrating, the vision, the hearing. It's pretty complicated. I mean, our bodies, it's amazing we could even get from point A to point B half the time,
yeah, it's, I mean,
So,
what our bodies are able to do for us without our conscious participation is
yeah.
incredible.
Yeah, it's amazing.
Yeah,
Well, I think I've kind of taken up a chunk of your time here and really appreciate it, but do want you to kind of maybe wrap up with some lasting points, or I did have the
yeah,
one question about how come one side feels more balanced than the other.
yeah.
I don't know if you have anything else you want to just kind of add.
No, absolutely. So one of the areas that we're learning from, we being like, the healthcare profession, we're learning from high level sports and athletics, right? And like NFL and NBA and baseball
Mhm.
players and soccer players and such. These men and women, these athletes who are extremely physically gifted and fit and
Mhm.
take care of themselves. But we're noticing, or we have been noticing over the last couple of decades, that when they blow out a knee or blow out an ankle or blow out a hip, it's not just the damage to the muscles and ligaments and the tearing of the tissues and the
Mhm.
surgery, but when you damage ligaments and damage muscles and damage tendons or have an entire joint replaced, right?
Mhm.
Well, if you damage the joint or replace the joint, that motion at the joint, whether it's a knee or an ankle or a hip or a couple of vertebrae in your spine, if you don't let those joints move, or if you just straight up replace them with fake parts,
Mhm.
you have now lost that sensory feedback from that part of your body.
Mhm.
And
Right.
your
Yeah.
brain now has to literally guess, where is my knee? Where is my ankle? Where is my surgical hip? I can't feel it. I
No.
can't sense it. Where is it?
Yeah.
And so your brain has to kind of fill in those neurological gaps with its best guess. And so it
Mhm.
uses what it can sense about, the joints above and below the damaged joint. So
Mhm.
I guess my reason for bringing that up is if you notice you have poor balance on one side versus the other,
Mhm.
think back and see if there's, think if you can remember any
Oh,
injuries
yeah,
to the poor, have you sprained an ankle or have you had a knee
right.
replacement or,
Yeah.
hip surgery and those kinds of things? Because that will lessen the feedback that side of the body is giving to your
Mhm.
brainstem,
Yeah.
and you'll experience that as poor balance on that side. So the way to fix that is just like with your neck and your eyes and such. The way you fix that is you figure out which joints or are this also happens with arthritis. If you have a lot of arthritic changes in
Mm.
a joint,
Yeah,
that's going to change the kind of sensory feedback that joint gives to your brainstem. So if you have that
right.
going on, whether it be injury or arthritis, give that joint some extra love and attention and work the
Mhm.
ranges of motion.
Yeah.
If it's an ankle, then do ankle circles, but do ankle circles while you're moving your eyes around or while you're moving
Oh,
your head and
okay.
neck
Yeah.
around.
Yeah.
And you have to get those areas to talk to each other again neurologically. So it's not always a lack of strength. Sometimes what's happened is you just removed the sensory nerve endings that,
Mhm.
that are needed for balance. And if you've
Right.
if you've
They
done
have to
that,
talk,
then you
your
kind of
body's integrated. It's got to talk to each other. And if
right,
not, yeah, it's kind of like, yeah, when you break a bone or something and you can't move that arm, and then all of a sudden, or your foot, and then all of a sudden you have to relearn it, you know,
exactly.
yeah, it's a whole different after six,
Yeah.
8 weeks and stuff. Okay,
Yeah.
good.
So
Thank you.
the rehab process has to take that into account as well, not just rehabbing the weakened muscles, but also rehabbing the neurological communication between that part of your body and your brain. And how you
Right.
do it is how we show you.
Yeah. Well, and I also like, this is just because this is kind of my thing, makes me feel better, is I love the whole thing about neuroplasticity and that
Yeah.
we can retrain and that we're kind of never too old. And we're that whole thing about, you can, because I've really noticed that with just the last year of taking some yoga classes, that I can now stretch where I, never could, and I'm kind of amazed and stuff. So that's, I think, really good to remember that we really want to be using all, be using it all and moving it all and
Yeah.
as
I
much
mean,
as we can,
that old school saying is true. If you don't use it, you lose it, right? And
Yeah.
balance is the same. If you don't test your body, if you don't ask your body to to have good balance. And if you don't put your body in situations or scenarios where it needs balance, and
Mhm.
it will begin to fail
Yeah.
you, right?
Yeah. Right.
So
Yeah.
you have to always practice and train on those scenarios in a safe
Mhm.
environment, and not always
Yeah.
in a very linear way. Sometimes we have to kind of get weird with it because that's how life
Right.
is.
Yeah, I think that's, yeah, that doing different, I think that's another, another like a test of why people cross train. You know,
Yeah.
they do a little bit of this, they do a little bit of that, and, they keep it mixed up. They don't just always just do the same thing so they can get,
And
different body.
that's what drives neuroplasticity. I mean, that's what research is showing us, is that
Uh-huh.
our brains thrive on novel situations.
Uh-huh.
So
Right.
if like, there's a limit to how much changes your nervous system will have if it's something you do all the time.
Mhm.
If you're just getting into doing Sudoku or crossword puzzles,
Yeah.
for a while there's going to be some neural growth, but after you've done them so many that it's just
Right.
kind of part of your
Yeah.
routine, it stops, right? So
Yeah.
presenting your body with novel situations, whether
Mhm.
they be physical in nature like balance training, or
Mhm.
cognitive like trying to learn a new language or learn how to play an
Right.
instrument, or a new skill like yoga, it's the newness of it is what's going to drive brain growth. As soon as it
Right.
becomes part
Yeah.
of your routine and habit, then the neuroplasticity part drops off. So you got to always
Right.
kind of switch up your, even doing your balance training in different rooms of the house. Don't always do it in the same room.
Mhm. Yeah.
That can also increase plasticity and neural growth.
Yeah. Well, that's a good, I gotta put that in the lesson plan that each week we'll do something totally different and kind of random and,
Yeah,
you know, and,
it's true.
it
Yeah,
does make it fun, it's nice to do, repetition's good for us to kind of feel secure, but then we gotta keep it a little bit, novel. So
yeah. You
anyway,
got to throw in a twist every now and
I'm gonna have you wrap up with some final thoughts and thank you for
then.
taking the
Yeah,
time to do this, but maybe you can just give us your one or two final thoughts on,
yeah. I
balance.
guess my one or two final thoughts are, be patient with yourself. You
Okay,
know,
good.
a
Yeah,
lot a lot of my patients that come to see me, they didn't get how they were over the course of a week or two. It took them,
yeah,
oftentimes years in the making. So when you're trying to reverse course and restore health and restore function, be patient with yourself and understand that your body
yeah.
is playing along, and also don't neglect, the other, I guess my other final thought would be, don't neglect the nutritional piece.
Okay,
I
yeah,
know that, balance is often thought of as a very physical thing, and it is very much a physical thing, but the receptiveness of those nerve endings in your joints, and the range of motion you have in your joints, and all that stuff, some of that's also dependent upon your nutrition. So making
mhm,
sure that
yeah,
have a well-rounded diet and get vitamin D and all
hydrated,
those kinds of things play a role
yeah.
as well.
Yeah, yeah, we gotta remember that and stuff too at this time, we're coming into the holidays and there's lots of tempting goodies and stuff. So,
Right.
okay, well, Dr. Jason, I am just gonna thank you again. I just
Of
was
course.
really fun for me. I learned a lot. And I really appreciate you taking the time to do this today.
Happy
So
to do
I'm
it.
just gonna, and I know I probably will be getting some questions, and so I'll probably be following up with that. And so I'm just gonna say thank you.
Yeah, you're welcome.
Okay,
Yes, have
all
a good
right.
night. Take care. Have a good class.